everyone, so today I'm going to be talking about Huntington's disease. Huntington's disease is an inherited disease. If you have a parent with the disease, you will have a 50% chance of inheriting it. It is autosomal dominant, so if you inherit the Huntington gene, you will definitely have the disease, but because of this, it does not skip generations because you can't be a carrier of it. The disease causes a progressive breakdown of nerve cells in the brain. Typically, the age of onset is in the 30s or 40s. The range of the age of onset, though, can occur anywhere from age 2 to 80. If it occurs before age 20, it's considered juvenile Huntington's disease. And in this case, the symptoms present a little bit differently and it progresses faster. To give a brief history, the disease was first identified in 1872 by a physician in New York named George Huntington. So this is just a picture of George Huntington. He studied a group of patients whose ancestors had immigrated from Suffolk, England, and then that's how he identified the disease, and then it was named after him. The cause of the disease is that everyone has the Huntington protein on their 4th chromosome, but the disease is caused by a mutant form of this protein. So Huntington protein is a CAG trinucleotide, and the mutant form of the protein extends too far. So the protein serves an important function for nerve growth and development, but we don't completely understand it yet. Just to give a better idea of this is what the normal Huntington protein would look like in a person without the disease. So you can see the CAG trinucleotide repeating, and then in a person with the disease, it repeats many more times. Now, some symptoms of the disease, it typically can be categorized as movement disorders, cognitive disorders, and psychiatric disorders. Some of the movement disorders associated with it are involuntary jerking or writhing, difficulty with the physical production of speech or swallowing, and impaired posture and balance. Some of the cognitive disorders would be difficulty organizing, prioritizing, and focusing, slowness in processing or finding the right words to say, and difficulty in learning new information. And then some of the psychiatric disorders associated with are social withdrawal, insomnia, fatigue, and frequent thoughts of death, dying, or suicide. Suicide is pretty common in people with the disease because, as I'll get to later, there is no cure for it. Another symptom that doesn't fall into any of these categories is weight loss. Now for the treatment, as I said, there is no cure for Huntington's disease, and no treatment can alter the course of the disease because there is no treatment yet that specifically targets the disease. The best that they can do so far is to treat the symptoms. So medications can lessen the symptoms, such as trying to reduce the involuntary movements or using antidepressants to help with mood. And speech therapy and physical therapy can help maintain the speech and mobility for as long as possible. The speech therapy can also help with the muscles in the mouth so that they can swallow and eat. Now, as of October 2015, so this is very new information, the first Huntington's disease patients who volunteered were successfully dosed with gene silencing drugs targeting the Huntington's disease gene. So they're the first patients to ever be treated with drugs that were designed specifically for Huntington's disease at its root cause. The type of drugs used are called antisense oligonucleotides, or ASOs, which are short, heavily modified bits of DNA that instruct a cell to destroy a certain gene. So basically what it does is it is going to shut down the Huntington gene. If phase 1 is successful and the drug is proven safe, another trial will have to be done to prove that the drug is actually reducing the Huntington's disease symptoms. So this picture just kind of shows how the antisense oligonucleotides work. So the gene silencing drugs interfere with the way that the genes are used to make the damaging protein. So the drug works by targeting the specific messenger molecules, as shown here, for destruction, which has the effect of reducing the levels of the damaging protein. So it kind of stops it right at the problem. Now, they really don't know if this treatment's going to work or have any effect on them, but the volunteers are willing to try it because since there is no cure, it gives them hope. And now we can have hope that maybe soon there will be a treatment or even a cure for Huntington's disease. So I hope that you all learned a little bit more about Huntington's disease today, and thank you.